Hello, Sadie Morway here. I'm a doctorate in athletic training student through Indiana State University, and I have with me here today, I have Nick. He's going to be our demonstration for a dorsal cuboid mobilization with movement. So the cuboid can be a big culprit when we're looking at ankle dorsiflexion. Often when we see a limitation in that dorsiflexion, it might be coming from the talocrural joint, and you can see the mobilization with movement for the TC joint in the other videos, but it also might be coming from that cuboid. So often we can see if there's a limitation specifically in dorsiflexion of the fourth and fifth rays, that can be indicative that we've got a little bit of that cuboid playing in as a culprit there too. So what this technique is going to help do is it's going to help to position that cuboid more dorsally. So what we're going to be doing is we're going to be applying a dorsal force to that cuboid as the patient is going to be moving through a pass or a plantar flexion and dorsiflexion range of motion. It's almost like that gas pedal movement. And so really what this is focused on doing, as many mobilizations do, is we're hopefully fixing a positional fault. So that cuboid right now is positioned more on that plantar side. So we're maybe having some deficits after that lateral ankle sprain. That cuboid can often sit more caudally, and we want to get it sitting a little bit more dorsally. So that's what we're focusing on here. This can also serve as a method of pain reduction. And again, that's often hitting those descending pain pathways and getting a lot of those good receptors firing so that we're having that pain reduction where we want it to be. So what we're going to be doing here is we're going to have the patient with the knee flexed. So they're in 90-90 position here. The foot is going to be in neutral, so it's really important with this mobilization not to pronate the foot too much. You don't want to be over pronating. You ideally want a neutral position. So just keep that in mind. You don't want to be forcing the foot too much into pronation. You're not going to be achieving the goals that you really want to of a neutral and healthy alignment. So in order to find that cuboid, we find the styloid process of that fifth ray. We slide over to the fourth ray, and that is right about where that cuboid is. So what I'm doing is I'm using my thumb. So I'm using the pad side of my thumb, and I'm just pushing dorsally so that cuboid is being shifted here. And really, you could even do a Maitland mobilization in the same pathway. But what we're going to do is we're actually going to do mobilization with movement. So you're going to use your other hand and you're just stabilizing the calcaneus here and try to keep that foot in as much of neutral as you can without, like I said, without pronating too much there. So I'm applying that force here, and I've just got his foot in the web of my hand. So as we're in this 90-90 position, Nick, you're going to go ahead and do like a gas pedal. So you're going to push your foot down, and then you're going to bring it back up. And the patient just moves through. So Nick, you're going to be moving through just a good range of motion. If you feel any restriction or pain, you obviously get to that point and come back from it. We're not trying to push past those painful barriers, but rather get to them and then come back from them. And eventually the patient is going to be able to get past those barriers. So we're gonna, since this is a new mobilization for this patient, we're only gonna do 1 to 2 sets, and we're gonna do anywhere between 6 and 10 repetitions at first. So just a couple more here, Nick, and then we'll take a little break. If you're doing more than 1 set, give them a little bit of a rest in between, maybe a minute or 2, and take a little bit of a break. And that is the mobilization with movement for the dorsal cuboid. Thanks.